Coming to you live from our studios in Nairobi, this is Morning Express. We are now on lifestyle, and today we focus on health. And of course, you may have read or you may have heard in regards to cholera outbreak that has hit the country. And it has been alleged that we've lost quite a number of lives so far to cholera. And this, of course, is a matter of concern. And on that reason, that's why I would like to talk about cholera this morning. And with me in the studio, I have Ruchika, who's a clinical pathologist with Lancet. Thank you for joining us.
Morning.
I also have Dr. Mohammed, who is MD for Ladnan Hospital. Thank you for joining us, Dr. Mohammed. I'll start with you, Ruchika. First of all, maybe we can just start by basically defining cholera. What is cholera?
Well, cholera is a bacterial infection. It's caused by an organism known as Vibrio cholera. There are very many types of bacteria known as Vibrio, but the specific one that causes cholera is Vibrio cholera. It enters our body through contaminated water, contaminated food, passes through the stomach into the intestine, where it exerts its action, produces a toxin which causes the classic symptoms that we see of cholera.
Okay, and based on that, Dr. Abdi, can we say there is an outbreak of cholera?
I would say we can't actually say unless and until we have a confirmed cases, and that depends on what the pathologists will see when they do the culture. Sometimes you can have what we call WHO case definitions, whereby people just use the symptoms to define and say this is cholera. But for you to actually say that this is cholera and this is the serotype, because you have different types that cause the cholera, it has to go to the laboratory. And maybe Dr. Ruchika can say more about.
Okay, Dr. Ruchika, do we have different types of cholera?
Yes. Now, under Vibrio cholera, there are two main types as well. And this is just dependent on the toxin they produce. Now, when the cholera produces a toxin, this is what causes the classic symptoms of the voluminous diarrhea that a patient will experience, because it prevents normal water and electrolytes from being absorbed, and as a result, they're all excreted out. Now, in terms of diagnosis, Dr. Abdi is correct. You do need a definitive diagnosis, and that's usually made in a laboratory to confirm that actually this patient's symptoms are because of the bacteria cholera. And we do have various tests, the main one still being culture of the bacteria to confirm. And then once we do grow it in the laboratory, we do further tests to try and determine which serotype it is.
Okay, so the fact that somebody has diarrhea or vomiting does not confirm that they have cholera?
No, there are a lot of enteric pathogens that can cause similar symptoms.
Okay. All right, you've mentioned some of the things that, or rather some of the paths that cholera can get to us, and you've mentioned, infected food and contaminated water. Dr. Abdi, are there other causes that may, have that path to have us get cholera?
Other paths,
other ways that one can get cholera?
No, the main ways is just contaminated food and contaminated water. So when people are infected, usually up to 75% don't have any symptoms. So you actually get 75% of people who are infected showing no symptoms, but excreting the cholera and infecting other people. The 25% who get the cholera will have up to 80% of them will have mild symptoms. And mild symptoms here we are talking about just diarrhea and vomiting. And the 20% will have severe symptoms, which sometimes can lead to severe dehydration. So having, and as I have said, it's just purely hygiene. Water and sanitation. That is the main thing. And actually, when you want to do the prevention, those are the two main targets for prevention of cholera.
Okay.
Yes.
All right, Dr. Ruchika, what would cause 75% to have no symptoms yet they're passing on the bacteria?
Again, it depends on what type of Vibrio you're infected with. And again, it also depends on your immune system. As Dr. Abdi said correctly, yes, not everybody is going to have the severe symptoms which are life-threatening. Depends on the dose of the bacteria that you've ingested, how your body tackles this bacteria in terms of how it fights it off, and there are certain serotypes. The major serotypes are the 01 and the 0139, which are severe. But you can get the non-01 and the non-0139 as well, and those cause mild symptoms. So it depends on the type, the dose, and how your body actually fights.
All right.
And actually, the common, to add on to that, the common ones that cause epidemic in our setting, mostly in Africa, is 01. The 0139 usually is found in Asia. So, and these are the ones that cause epidemic. Doesn't mean the others cause individual cholera, but the epidemic and outbreaks are mainly those two types.
All right. Just a reminder, you are welcome to participate in the conversation. Maybe you have questions, comments, possibly things that maybe you may want to understand regarding cholera, especially if in your area you've seen people with symptoms, or you maybe have symptoms and just want to confirm certain things. Feel free to give us a call on the number that is displayed on your screen, or you can also tweet, and the Twitter handle is at Michael G. Gitonga. We'll be more than glad to see whether we can handle your question right here. And with me, just a reminder in case you're joining us now, is Dr. Ruchika Kahl, who's a clinical pathologist, and Dr. Abdi Mohammed, who's an MD at Ladnan Hospital. Tongue twister there. And Dr. Ruchika, coming back to you, are there areas that would be considered high risk where the bacteria can spread very fast?
Yes, definitely. You know, areas with poor hygiene, poor sanitation, stagnant water are all areas considered as high risk.
When we talk about poor hygiene, what is poor hygiene?
Not having adequate sanitary facilities, not having adequate toilets, not having adequate hand washing facilities, inadequate water supply. Those are all considered poor sanitary practices.
Okay.
And actually, usually in our setting, it will be in the slums. And in countries like ours where we have refugee camps or camps that have internally displaced. And as we said, the two main things, sanitation and water. As long as there is no clean drinking water and as long as there is no proper disposal of excretion, then it easily spreads. And that's where you have epidemics. You will not find epidemics in Runda or in Karen. It's not possible. You will only find in slums,
highly densely populated
Yes,
poor sanitation and lack of drinking water.
How fast does the bacteria spread?
Oh, very fast.
And usually
Hours.
what happens is the incubation period. Let's say you ingest the food today or the drinking water that is contaminated. It takes from 2 hours to a maximum of up to 7 days. So basically, one might get the symptoms within the next 2 hours. By 10 o'clock, you have already the symptoms and you have been exposed right now. And that's why you have these epidemics. Or sometimes it can take a day, 2 days, 3 days, 4 days, up to a week before you develop any symptoms.
Okay. What makes the difference between it, developing symptoms within 2 hours and days?
As she said, the amount that you have been exposed to, how virulent it is, and your immunity. And actually, severe symptoms are usually seen in people living with HIV/AIDS, people who are malnourished, and maybe young children whose immunity are not yet fully developed. So those are the people who get the severe diseases and the ones who develop the symptoms very quickly. So
and unfortunately, those individuals are also living in the areas which are high risk.
Densely populated.
Exactly.
All right, Dr. Ruchika, you mentioned that for you to actually confirm it is cholera, you'd need to go to a laboratory for them to do their tests.
Yes.
But are there some self-tests that one can do, especially given that diarrhea and vomiting are fairly common occurrences with food poisoning? But is there something that distinguishes between the two so that now I'd know, well, this is just food poisoning and I'll get over it, and this is cholera, I need to take action ASAP?
Well, in a classic case of cholera, the diarrhea will be very severe. It will be watery. The chance of getting dehydrated quickly is a real danger. The stool in itself, if it's the characteristic type, has a certain appearance. It looks like what is described as rice water stool, very pale water with mucus flecks. But now that we know that we are seeing a lot of cholera in our country, I would not just sit back and treat any food poisoning lightly. If one does have symptoms and the symptoms are aggressive, they're persistent, make sure you do rehydrate yourself. And if you're not getting better, go to a medical.
How long does one give themselves if you're not getting better?
It depends on even the extent of the symptoms. How many times are you passing stool? Is it completely watery or is it partially solid? You know, as Dr. Abdi said, 2 hours, you can have very severe symptoms.
Yes, Dr.
And even death within the next few hours, depending on how severe it is. And the other classical symptom is it doesn't have fever.
Yeah.
Unless you have
another infection,
or you have you are someone who is living with HIV/AIDS, where you get the severe. But normally, you just have vomiting and watery diarrhea, nothing else, no fever, no other symptom. So that already rings a bell that there is more. And actually, the mainstay of treatment is rehydration.
Yeah.
Okay. And now, I'd look at one of the challenges, especially given that you've mentioned that the areas that are prone to have this bacteria more are densely populated. And the reason why they're densely populated is possibly because of economic issues. People are living there. Now, let's talk about cost. How does one have this treated? And is it costly to have it treated? Because, again, you look at the number of people infected and the rate of the infection is definitely within the dense populated areas.
No, it's not a treatment that is highly costly. What you just need is to ensure that you get adequate rehydration. Depending on the severity, even oral rehydration salts, sachets, which are readily available in health centers, can be used. In those who have severe dehydration and are in shock because of the dehydration, will require intravenous fluids. Again, in those who the diarrhea is unremitting, they may require a course of antibiotics. And even the antibiotics that are used are not, they're the basic first-line antibiotics. So it's not costly to treat. I would say what is costly to treat is the underlying factor behind the
and which is
spread.
the sanitation and the main drinking water.
The factors that are, promoting it.
Exactly. Those are the ones that, and that is what you target when you want to do prevention of epidemics. And those are the mainly costly things. You cannot go overnight and create proper sanitation in a slum within days or a day or 2 days. So already that tells you that, and actually it's used as a social indicator. How developed a country is. Once you start getting choleras, it says a lot about how your social welfare is developed within your country. So the other treatment is mainly oral, as you said, unless you have the severe form, which will take you to a hospital to seek intravenous IV fluids and a dose of antibiotic, just to reduce the need for more intravenous fluid and the excretion to reduce the lifespan. So, but mainly it's not very costly. And the first thing that actually needs is the treatment. Then you have water and sanitation and health education.
Okay. Twofold question. Assuming I'm handling a patient with cholera, what should I be cautious about? And number two, if I am the patient with cholera, what should I also be cautious about?
Again, if you are the healthcare worker taking care of a patient, you must ensure that the facility in which you're taking care of the patient, whether it's your home or whether it's in a healthcare facility, you exercise what we know as enteric precautions, meaning that the water source that you use should be as free from contamination as possible. Boil your water. There are a number of easy filtration methods as well. As mentioned earlier, excretion of waste product must also be carefully done. When a patient is having diarrhea, make sure that they're clean, they're defecating in a designated area, their feces is not being spread all over. So, and then remember that they are also shedding actively. the bacteria infection. So it's not just short-term measures, but for a couple of days, even after symptoms may subside, you still must exercise these enteric precautions.
When you say that actively, what does that mean? Does that mean that it's not only through the fecal area and the water, the contamination?
When somebody is infected, they're actually shedding the bacteria in their waste product as well. Yes.
So meaning they have the chance of infecting more people.
Yeah. It's
Even
a mode
after
of
the
spread.
symptoms have subsided.
Exactly.
Yeah.
Okay.
Or even the ones who don't have symptoms.
Yes.
Are excreting, infecting other people.
Yeah.
They don't have the symptoms.
But they have the bacteria.
They have the bacteria that they are shedding. So they are infecting more people. If those two things are not properly, the waste management and the drinking water.
Okay, if I had the bacteria, for example, and I'm drinking water, can I share that water? Can I share the plate? Are those areas that are considered risky?
As long as your hands are not soiled with fecal material, yes. I would advise that you have one clean source of drinking water. You don't share the same water that you're drinking. You do have to take certain precautions like that. Can I get it from touching you or something to that effect?
No.
No. No.
Okay,
Yeah.
let's talk about prevention. Are there ways that we can prevent, especially the spread?
The spread, as we have said, the first thing to do is set up. First, it has to be defined that there is an outbreak, and then the next thing is set up treatment centers in that locality where there is the epidemic, and the next thing is to provide clean drinking water to the population in that area, and to have proper sanitations and excretion of waste. The other thing is to, when you are treating the ones who are infected, actually you are preventing as well. So when you consider those 2-3 factors, the next thing is to stop what the gatherings that you have, like food handling in matangas, arusis. For some time, while there's an outbreak, you don't have those communal eating taking place because you cannot make sure that there is proper sanitation. Then the fourth thing and the most important crucial thing is health education. The public must be aware that there is cholera outbreak, and this is how you can prevent, so that each and every individual must take responsibility. The basic things that we have been taught in primary school: wash your hands after you go to the toilet, wash your hands before you eat. So those simple things are the ones that do prevention.
All right, Dr. Ruchika, you mentioned that it's unlikely to find an outbreak in areas that are not densely populated. However, it does not mean that you cannot, get cholera in those areas, and especially given that we are in and out of the house.
Yeah.
And possibly, what tips should we share, for instance, with our house helps, with those who are helping us, and amongst each other within the house setup, to ensure that even if one came with an infection, it does not spread to the rest? Some of those things that we may just take for granted.
Yeah, exactly what Dr. Abdi has just said. One, I would educate the people that I live with, the people that I work with. Wash your hands every time you visit the loo. So one responsibility is to make sure that there is a source of clean water that somebody can wash their hands with. If you can afford it, even the antibacterial agents that are now available in the supermarkets can be used. Wash your hands before eating. Make sure that when you want to pass stool, again, it's in a designated pit latrine, toilet, etc. So those are some of the very basic tips. Boil your water. If you can't boil your water, there are certain filtering techniques that are available. I mean, even using simple cloth filtration, passing water through layers of cloth, clean cloth, can be used. Of course, for those who can afford it, and I think now I'm sure the government does have it available, vaccination is available, but we don't consider that the sole preventer in an epidemic. It can be used as an adjunct, but not on its own.
Okay. All right, we'll take a call from Willis. Willis, thank you for calling. Go right ahead.
Yeah, thank you very much. Please pass my regards to the two doctors in the studio.
Thank you. If you can just speak a bit louder, Willis.
Okay, thank you very much. I wanted the two doctors to be very specific on the drugs that are used to manage cholera, especially when you confirm the cases, yeah?
All right.
Because there are some controlled drugs. And coming from a locality where people just come to a pharmacist and buy drugs, whichever quantity they want. And there are drugs like, say, tetracycline capsules. If they are misused, I understand during the outbreak, the patients who misuse them can never be easily helped when they are brought to health facilities. So what do they say about that?
All right. Thank you, Willis from Kisumu. Yes, Willis, they're asking about the drugs.
No, we would advise patients not to buy drugs over the counter. And as we said, the majority will develop, the 80% will develop mild to moderate, and that can be treated with oral rehydration salts, those sachets that, but for the antibiotics, it has to be done in a health facility, not over the counter. So it's, you prevent by proper the drinking water and all that, and the treatment is oral rehydration salts.
Okay.
That's what you need.
Dr. Ruchika, we have a culture, so to speak, in this country, and I'm weighing on what Willis has said, where we sort of classify certain things based on just how we feel. For example, people will walk into a pharmacy and say, I have malaria, not because they have proved it, but because they may be feeling a bit feverish. And now with the cholera outbreak, or the alleged cholera outbreak, we have diarrhea and vomiting. What is the risk of somebody going to a pharmacist and just asking for medicine to deal with diarrhea and vomiting?
Well, you're right. The culture is unfortunate. Yes, there are antibiotics available to treat this infection, but as Dr. Abdi has said, not everybody, even with classic symptoms, needs the antibiotic. So do not walk into a pharmacy and say, I have diarrhea, give me ABCD. I think the pharmacists also have a role to play now to ensure that if they do receive such patients, they do refer them to the appropriate health facility or give them at best oral rehydration salts. When antibiotics are used, they should be prescribed by a registered medical practitioner. There are various types. Tetracycline is one, but we do have what we call second line. There's doxycycline, there's chloramphenicol. And this is a conversation for another day, but you know, we are seeing resistance to the common first line antibiotics as well. So by patients and the public walking into pharmacies and just buying antibiotics because they've read it on the internet actually increases the risk of this bacteria developing further resistance. And you know, there might be a time when we don't even have antibiotics left to treat. So don't do that.
Don't do that. Don't try this at home.
Yes.
Go to the doctors. Definitely. All right, Dr. Abdi, in regards to adults and children, are there possibly quicker, or how do I put this? Is it riskier for children as opposed to adults in terms of the time frame between the time you get infected and actual death if not treated?
Yes, it's the risk is higher in children. But cholera affects both adults and children, irrespective of your age. You could be as old as 90 years old, you can still get cholera. And the people who have higher risks or develop severity are the children and people who have other conditions like HIV or who are malnourished. Those are the people now who develop severe, very severe diseases. Or you could be having other immunocompromising conditions that, or you are on medication for cancer, which lowers your immunity, meaning that now your immunity is very low and you have risk of getting very severe disease.
All right. Yes. Eve from Machakos, thank you for calling, and we're listening. Go right ahead.
Hello?
Yes, good morning.
Good morning.
Thank you for calling, Eve. Go ahead.
My name is Eva. Dr. We just mentioned that we can filter drinking water to prevent cholera. I don't think that would help, because the issue here is that killing the bacteria. So I think the right information we should be giving the people in the community is ways that they can kill the bacteria, and also ways they can prevent transmitting the same to others.
All right, thank you, Eva.
My options would be boiling water and treating this water to kill any microorganisms that may be there. Filtering will only remove the dust. but
Okay.
not the causative agents of the disease.
All right, thank you, Eva. Your
yes,
comments on that?
I want to reiterate.
Yes.
Of course, the best way would be to get distilled water, get filtered water. Remember, there are many filtration techniques. UV light can be used as a filtering technique as well. And in communities where they don't have access to boiled water, you do need to give them some form of option. So when I say filtering, it's not just filtering to one piece of cloth. There's actually a technique one can use, and you can filter it through layers of cloth.
And that to get rid of the bacteria?
Many layers. Yeah, you're filtering it out. And remember, the cloth you use has tiny pores. So that is one way of actually trying to get rid of the burden of the dose of bacteria. It may not be the best way, as you say. Of course, the best way is boiling, but we must give options to all the public
But I guess
out
when we
there.
say and talk about the filtering, one would have to scientifically be aware of
How to do it.
what cloth and how to do it.
Yeah, fair enough.
Okay, Doctor, you've also mentioned boiling as one of the ways, especially to treat the water. Is there a certain temperature or is there a certain way you boil in terms of how long do you let it boil? Because you could just heat water and the minute you see bubbles coming up, assume that is okay.
I would say boil for 5 to 10 minutes, actual boiling. And
From the point it actually starts boiling.
yes. And you see, we are not looking at just one method of preventing. Clean drinking water or proper sanitation is very crucial. So if people who are infected seek treatment early and participate in ensuring that they excrete their waste properly, then there will be no need of having
that.
Yes, exactly.
Okay.
So, and then making sure that the source of water is very far from any sort of latrines or such. And with the rains now, I don't know, it will be very difficult and very challenging to prevent, especially in slums where water carries
Freely
almost
flows.
Exactly.
All right, we'll take a call from Abdi in Wajir. Abdi, thank you for calling. Good morning.
Good morning, sir.
Yes, go right ahead.
Yeah, I wanted to speak with Dr. Mohammed about this also.
Mm-hmm.
Yes.
Hello? Hello?
Hello?
Yes, Abdi, go ahead.
Yeah, and there is also a disease called trauma outbreak in Wajir,
Mm-hmm.
which is now disturbing all over Wajir town and the entire, that is caused by the same polluted water.
Mm-hmm.
So we're also asking the doctor how far is that, because if we have asked most of the nurses there, they say this is caused by a water problem in the area.
Okay. Your question is how far... What is your question? I missed that.
And also water cause the same problem as cholera, because this is also another disease that really disturbs the eyes.
You're asking whether water can cause the disease?
Yeah.
Okay. All right. I think that you'd already, we've pretty much talked about that, that one of the main parts that it would use is contaminated water. Remember, we are talking about cholera this morning, and with me in the studio is Dr. Ruchika and Dr. Abdi, and we are mainly looking at cholera outbreak in the country. So if you have any questions, any comments or concerns, feel free to give us a call. The number is on your screen, and we'll be more than happy to answer your question. We have another call. Frederick in Kisumu. Good morning, Frederick.
Good morning. How are
To
you?
your comment or question. Very well, thank you.
Yeah, say hi to the two doctors, please.
They can hear you.
Yeah, what I wanted to ask, what are the best water treatment agents in the market?
What are the?
Sorry?
What are the what?
Water treatment.
Best
What are the right water treatment
right.
agents in the market?
Yeah.
Okay.
Wow.
Thank you, Frederick. All right. Yes, what are the right water treatments in the market? And I
Actually-
guess just to add on to that so that we answer that fully, you have all these, things that you find in the supermarket, filters. Are those checked, verified that they can actually treat this kind of water?
Yes, actually, some of them have been, and they will tell you that WHO certified or something like that, that they have been proved that they can provide clean, safe drinking water. And clean, safe drinking water is lies squarely with, I would say, the authority, whoever it is who is in charge. In this time and age, we should not be talking about clean drinking, safe water, especially in the city. Those should be
readily provided,
given, that everywhere this should be available. Other than the gadgets, there are those detergents or tablets,
yes, yeah, that you can buy also.
Yes, the water guard.
And those are readily
available.
Yes.
Exactly,
Okay.
exactly. But the simplest, commonest method, boil, if you have access.
Okay. Dr. Ruchika, that sometimes a notion that boiling water is possibly water that has been brought either from a river or from a source that we don't know. Should we boil tap water?
Yes, you can. I personally boil tap water as well in my home, and touch wood, wherever that is. I have not suffered from any severe illness yet, so it does work. Yes.
Okay.
And but if you talk to the experts on the other end who provide water, they would tell you
Never. Yeah.
don't boil,
Yeah.
because they have treated. You are actually killing, removing the chlorine that they have used, the
yeah.
chlorination that they have used.
When you boil the water.
Yeah.
When that is if you are getting properly treated water.
Tap water.
Municipal water.
But there's also the
Exactly.
notion that we kill the minerals within the water when you boil it. You know, minerals that are
there's-
helpful.
yeah.
Is that true?
I mean, as Dr. Abdi is saying, yes, I mean, you can say that boiling can also cause damage to essential nutrients or trace elements that are in the water. But I guess it's a flip. You know, you're not actually sure of the quality of this municipal water. You know, yes, it's supposed to have a certain number of coliforms, it's supposed to have a certain number of amount of chlorine, amount of fluoride, but we don't have that information readily available to us. So, I mean, if I was personally asked to give my opinion, we do have this epidemic. We're not very sure of our water source. Boil it.
Boil it.
Yeah.
Brian in Nairobi, thank you for calling to your question or comment. Brian?
Hello,
Hello.
hello, thank you. I wanted to ask, supposing maybe you have a patient within a village setting where the facility is quite far, and maybe you want to attend to this patient, like offer first aid to this patient. How do we go? And then I've heard the doctors talk about oral rehydration. So how can we go about it? Because you know this ORS, they're found in the health facility.
Okay. Thank you, Brian. Yes, for a patient who has health facilities that are quite far, how do you handle them between the time you discover and when they get to the health facility?
Basically, when you are at home and you don't have any oral rehydration salts, you can use clean water mixed with some salt to give them, to rehydrate. And the main killer of cholera is dehydration. That's what kills you, not anything else. It's not the bacteria.
It's not the actual bacteria.
No. It's dehydration. You lose a lot of fluid that you easily go into coma and die. So to prevent now, that's why you use the oral rehydration salts. And if somebody is not retaining, the oral rehydration salts are given, but whatever they are vomiting is more than what they are taking in, then now you will have to go in and get the IV fluids. That's why now the IV fluids comes, and that's why a health center or a place is very crucial. You cannot just do it at home alone, because you wouldn't know
How much?
exactly, is it enough that
Or too
this
much.
oral
And in the
rehydration-
water, do you just give plain water, or is it advised to add salt or sugar for energy?
Salt.
Exactly.
You can even give Fanta and add salt in that.
Yes.
That's
Add salt.
Yes.
It might boil over. I remember we used to do that when we were kids.
The normal water plus some salt,
Yeah.
if you don't have the oral rehydration salts.
Okay.
But the most important, the oral rehydration salts has more other...
Can you add sugar?
No.
Sugar
There's
is not
no-
advisable
there's
for
no-
energy.
I don't know.
Okay.
It's mainly electrolytes that
Yes,
you want to try and
exactly.
add.
The sodium and potassium.
Yes.
Okay,
yeah.
so those come through salt.
Yes.
All right, let's talk about food and food handling, because one might assume now that we're talking about boiling water, food is constantly being heated. Is that possible to have infection through food that has been cooked while it is still hot?
It depends on, how it is cooked, what is the water source that it's cooked in. Of course, if it's properly cooked, the chance is less. But then even the food handler who's handling that food, during the preparation phase, even after it has been cooked and they're serving it, are their hands soiled? Are they themselves shedding? So those are also dangers that can contaminate the food.
And usually things like fruits, where someone just handles with contaminated hand, and you start eating without washing them properly.
Do we know how long the bacteria, for instance, can survive exposed? Like now, if I handle food and I am infected and maybe stay for an hour and somebody else eats it after an hour?
It's a very delicate bacteria, doesn't survive very well in the environment. But I suppose once you have contaminated fruits, the chance is still there. Even though it's delicate to the agents that we can treat it with. So I think it can stay in the environment for a
Actually,
number of
the
days.
reservoirs are human beings and sea water.
Yeah.
That is where you have the bacteria surviving in. So it has to be through individuals that pass across, or you have sometimes they talk about seafood, which is not well cooked.
Okay.
Also becomes a source of
the bacteria getting to you. All right, we'll take our last call, and that's from Caroline in Bomet. Thank you for calling, Caroline. Go ahead with your comment or question.
Hello, my name is Caroline.
Yes.
I'm calling from Bomet County. And Bomet is one of the counties that was affected by cholera. So we have water guard, aqua tubs. So at times we tend to put all of them in the water. Is there times we are misusing?
Okay.
Yes.
We have water guard,
Here's one product.
aqua tubs. So we were given. So we put all of them in the drinking water. Is there a time we are misusing?
Okay.
Or is it just correct?
All right. Thank you for calling, Caroline. Yes. Would you like to take Caroline's question?
I would say one would be more than enough to use one type of product, unless you are not sure of, and if you're not sure, then it means you use the usual way. Just boil
the water.
Yes, exactly.
It's anxiety, I think, that makes them make sure that
you throw
all
in
the
everything.
protection that you have. Yes, but one product should be sufficient.
One product should be enough.
Yes.
All right, Dr. Abdi, maybe as we're talking to the public right now nationally, what is the one thing that you'd want them to know in regards to cholera?
Before I talk to the public, what needs to come out is we are hearing that there are outbreaks, and you see health being devolved. There is no overall body that comes out and says that yes, cholera has been proven that there is, or tested that there is cholera outbreak. So as long as we are just assuming that it's cholera, there will be a problem. But if it's truly cholera, then the main things are just hygiene, proper sanitation, and clean drinking water. The basics that you have been taught in school: wash, drink clean water, and make sure that you are safe from cholera.
Okay. Yes. Dr. Ruchika, maybe what you'd want people to know regarding cholera?
Agreed. We've heard that there are cases that have been diagnosed. There are deaths. So as an individual, you need to take care of your own health and the health within your community. Clean water, wash your hands, make sure that you dispose of your excretory waste as best as possible. In the interim, try and avoid eating from places where you're not sure how their water source is. Try and eat most from home until things subside. If you have symptoms, please do not wait to see if symptoms are going to deteriorate further. If you do have the ability, go to the nearest health facility. As mentioned, in terms of the first aid, if you do have somebody who is having severe diarrhea, start the first aid with the oral rehydration as you get to the nearest health facility.
All right. Well, I hope you're taking those notes, because it is a matter of concern regarding cholera and putting you at risk. It is a potentially fatal illness, so we need to be careful. At this point, I'd like to bring in Sophia. Sophia?
Yes. You have brought me in. Anyway, thank you, Michael. That was a great discussion. Thank you for joining us, because, of course, the stats and what we've been reading about in the papers has been worrying, concerning. And as you said, that health is now devolved, so we should see more of the counties coming out in addressing these kind of issues, especially that have affected some counties that we saw in the report that was released the other day. So thank you for joining us this morning. And that's your health. And we're about to just wrap up the show. We thank you as well for all of your feedback this morning. Quite a number of tweets, a number of them have been addressed. The questions by Michael on your health this morning, where he was focusing on cholera, but also earlier on with the Cabinet Secretary, that is East African Affairs, Commerce and Tourism, Phyllis Kandiash was with us and managed to also answer quite a number of your questions, tackle the various subjects that arise from her docket, quite a heavy one. And I remember somebody saying whether she thinks it should be broken up to allow her to focus on some of the areas, but she argued a common thread exists with the three areas. And also on tourism, she called upon everyone to help the ministry sell Kenya, brand Kenya better to the rest of the world. So we'll wait to see, however, because they say as a ministry they're still putting a lot in place, even ahead of President Obama's visit, to ensure that they can capitalize on that to reap. So it should be an interesting one to watch as the days come and go by. Michael is now standing next to me. You know, this is the magic of television.
Yeah, and earlier on, the director was telling me, move your hand, because I'm sure you could see my hand somewhere in there. But yeah, those are some of the things that happen, yes, when we are here. But thank you for keeping us company. It is live television, so
the intrigues of live TV.
But always a pleasure to be here with you and for you to be here with us. Otherwise, that would prove that we're mad if we're talking to ourselves.
Well, you'd be talking to me. I'm not mad, and you're not mad.
We're talking to some thing there that's a black.
Talking to the director. Maybe the director would be mad. Anyway, thanks for watching. We'll see you tomorrow. We have a great show for you. There's been a lot. Remember the president's remarks in Bomet the other day, on Sunday was it, when he said the newspapers are just about wrapping meat and it's the media that is playing up this conflict or war of words between the two Rutos and fueling it. So we're going to talk about that in the newsroom tomorrow. We'll also talk about something that happened in a competing media house with one of the guests who will join us tomorrow. He was invited for a show, and then when they got there, yeah, some interesting stuff happened. So it'll be an interesting one. You don't miss the newsroom tomorrow.
Yep. So this is where we wind it up and wish you all a fantastic and a wonderful day from us here, the Morning Express crew, and those behind the scenes that make this happen. Have yourselves a great day.